In recent years, guys have been told to embrace your dad bod. It describes a man who has maybe a little extra stuff around his stomach, maybe, but doesn't look bad by any means. Still, though, a new survey shows most guys don't really understand the actual health implications of keeping that for years. Joining us now, the Chief Medical Officer for the group MDVIP, Dr. Andrea Clements. Doc, thanks for coming on. We appreciate it.
Thank you for having me.
All right, so let's talk about dad bods. I mean, dad bods, that's not obese, maybe just a little bit extra to love on, but you say there are some health concerns when it comes to these dad bods, which seem to be, something we're all talking about recently.
It is something everybody's talking about. And for people who don't really know, think Will Ferrell or Jack Black versus maybe The Rock or Arnold Schwarzenegger back in the old days. It's that little bit of fat around the middle when you look pretty good everywhere else. But that fat around the middle is also internal and surrounding your organs. And that fat tissue makes you at increased risk for heart disease and diabetes and even some certain cancers.
So what's the easiest way to tackle that sort of body shape and that sort of fat that a lot of, let's be honest, most men have?
Yeah, I mean, the important thing is to work with your primary care physician and really help you talk about, what sort of lifestyle changes you need, what other things you need to do, and if there are really any other medical conditions that could be contributing to it that they could help you control.
Your survey, you did a survey, and you found that most men seem to be motivated to be healthy. That's a positive thing that most guys want to do. But when it comes to actually going to see a doctor, and this has been the case for decades now, men are some reason resistant to it, and it manifests itself in a variety of different ways.
It does. The MDVIP survey supported this. About 40% of men said they only go to the doctor if there's something urgent or something really bad going on. Think of it more of men need to be more like their cars. I mean, you take your car in for an oil change, you go in when it's working well so that you can keep it working well. And
a lot of men don't even realize heart disease, I believe, is the #1 danger to American men today. And a lot of men don't even know that.
It's true. 90% in the MDVIP survey didn't know that. They thought it was cancer. But interestingly, 80% didn't know that a colonoscopy can help prevent cancer. So I think there's just a lot more education that needs to be done.
So the big takeaways here, you do not need to look like The Rock. And you don't need to look like Arnold Schwarzenegger.
Good.
No chance. But I think guys need to be more comfortable talking to their doctor and going to get routine tests and going to get their physicals.
Again, you're putting me right on spot.
Those yearly checkups are so important.
It's men in general, I feel like, are so bad about this.
I get it. I make my husband's doctor's appointments. Otherwise, I don't think he'd go.
Yeah, so I haven't got a physical since before the pandemic. So that's why Sarah is giving this look to me.
Yeah, that's right. It's only because I love you.
I know, and I appreciate you caring. So now I have a 5-day window that I need to book a doctor's appointment, or else I'm going to have to deal with that
Good
look.
luck with that.
I know, thank you very much. I appreciate it. And thank you for caring.
Yes, sir.